A good exercise that the book does them opposite, because you have to do that exercise on a test. You have to know which way this thing is sitting, right? You have to know which dorsal, which ventral. Doesn't that make sense, right? And you use your landmarks. You use your bony landmarks. And the fact that it's a bifid spinous, Peter picked that up, that right away, you know that's got to be cervical. Only in the cervical spine do you have bifid spinuses. But then if you look closer, you see this blood vessel coming through. This is sitting like this in your neck, right? This is the anterior side of the vertebrae. That's the posterior side, all right? So coming up from C7 all the way up into your brain is the vertebral arteries through the transverse foramen. Can you see why you need to know your bony anatomy, right? How can you know anything else if you don't know the bony anatomy? You're lost, you're dead in the water. So please study for that next week, all right? Okay, so this is the vertebral artery and vertebral veins going through the transverse foramen. This is the vertebral body here, right? This is the bifid spinous process. There's your lamina. This is your superior articulating facet, right? And the whole thing is a process, a superior articulating process. I know it's superior because the way the angle of the lamina is coming down, right? Kind of slightly down. See how it kind of comes down on an angle this way? This has got to be the superior, it can't be the inferior, right? It would be underneath, right? So you have your spinal cord, you have your coverings. You have the dura mater, number 5. Number 4 here is the arachnoid, and number 28 is the pia here. I'm using that number because it says it there, but don't go by the numbers because look, it says 24 here too. So
the pia is like most deep to the.
Yeah, this whole thing is the pia. That's the one that's like the skin on the brain and spinal cord. And the in-between layer, they call arachnoid, it really looks like a spider web. And notice the big space between the pia and the arachnoid. That's the subarachnoid space, that's where the cerebral spinal fluid is, right? So, okay, so then here again, you see it on this side. You'd have the dura mater, the arachnoid, and the pia, the subarachnoid space. The disc would be in here. If the disc went straight back, it would cause pressure, and the pressure, if the pressure was great enough, it would cause pressure on the subarachnoid space, right? And that subarachnoid space would be like the water bender we talked about pushing on the cord, right? And now the cord has pressure and it affects the spinal cord's function. And if it goes from the front, it's going to affect, which one is this? What horn is that? Ventral horn, which is motor. So it affects your ability to use motor, right? If the pressure was coming in the back, it would affect more the dorsal horn, affect more sensory. You know, it's theoretical, right? Okay. This is all white matter. It means that superhighways of myelinated tracts sending messages very fast up and down the cord. The dorsal horn, the lateral horn, and ventral horn is gray matter. They're processing centers. So like we saw on this right here, this is showing you like the simple reflex. If you touch that, you would feel something, right? If you put a pinprick, you pull your hand away, or hot, right? So if you go on the internet and look up images of the simple reflex, you see a lot of them, you show a flame on the guy's finger rather than a pinprick, right? So if that was your finger, here's the epithelium, here's the dermis, right? There's these neurons, there's the mysis corpuscle, and then there's free neurons, something pressed on it or heated it up. This is a dendrite, actually, of a sensory neuron. This sensory neuron is not multipolar because it only has one dendrite, you know, technically coming off the cell body. So it's what? Unipolar, right? Instead of multipolar. It's a sensory neuron. The sensory neurons have their cell bodies found in the dorsal root ganglia. And then the axon goes in and synapses in the dorsal horn with an interneuron, which is a multipolar neuron because it has many dendrites, right? And that interneuron is going to synapse again in the ventral horn with a motor neuron, which is also multipolar, has many dendrites. And this motor neuron is going to send a message to the muscle to pull the hand away. That's a reflex, simple reflex.
So
you
motor
don't,
neurons also always on the ventral side?
Yeah, motor is always from the ventral side. But yes, so the point I'm trying to make is that, I was about to say something when you said that. I lost my train of thought. Okay, so the interneuron interacts with the motor neuron and it causes a reflex of pulling the muscle away. All right, that's a simple reflex. If I did a deep tendon reflex and I hit somebody's knee and it pops like that, right? What is that? I'm testing the level of the spinal cord where those nerves travel to that. So if there's any kind of damage with those nerves to the quadriceps, that's from L2 to L4. If I did it in the biceps reflex, and I hit the biceps right on the radial tuberosity of the radius, that's where the biceps inserts, and I hit it with the hand relaxed, it does something like that. Or the brachioradialis, it does that. Those are testing basically same levels, C5 and C6. And so you're testing those levels of the cord where the nerves go to that area. What am I testing? It's a sudden stretch of the muscle, and it actually responds as if somebody put a sudden weight on it and you had to hold it up there. That's called a Golgi tendon reflex or a deep tendon reflex. This is a simple stretch reflex or pinprick, pain reflex. You're trying to pull the hand away. So you see. Now, did I need this? Now, this is what I was going to talk. Did I need my brain to do that? No, it happened at the cord level. Does the brain know it happened? Yes, it does. So there, it doesn't show you, but there is a nerve that goes across to the other side, right? And it sends stimulus up to the brain to tell you what you felt, right? So you feel it, but you didn't need the brain to do the movement. That's the point. You understand that? That's why.
PNS or SNS?
What's that?
This is part of the PNS or SNS?
Yeah, this is all PNS. PNS is outside, but inside, this is what's happening in the CNS. Remember, the CNS tells things what to do, and receives input and processes it and tells things what to do. So it's receiving the input from the PNS, right? It's processing it and telling it what to do as a reflex. But also the brain is registering the memory of it. So like the first time you touch something hot, you know what hot is now, right? You learn that. It's painful to touch that, right? Okay, so getting back to this one. So dorsal, ventral, you got that? Make sure you get your bearings. Always say, remember I told you right from day one, know your view. What am I looking at? Get your bearings. North, east, west, south, right? This is posterior, anterior, lateral, right? So posterior, anterior, lateral. Does that make sense? Right? That's the gray matter. This is the central canal. This is the gray commissure. Connects the right to the left. Yeah, it's like a bridge, right? Going across. And there's a central canal going through, which allows CSF to flow through. What else we got here? Okay, so you have your ventral rootlets forming your ventral root. Your dorsal rootlets forming your dorsal root. The dorsal root forms the dorsal root ganglia before it becomes and joins with the ventral root to form the spinal nerve. That's your spinal nerve right there. Can you see it? Spinal nerve. And then the spinal nerve is coming out. It branches into a ventral ramus and a dorsal ramus. The ventral ramus has a little unique aspects of it in that if it's going to be going to ganglia, you have this communicantes rami, thank you. Rami communicantes, excuse me. And this would be a sympathetic chain ganglia right there. That's what that would be. So it may not label it on the picture, but that's the sympathetic chain ganglia it's going to. Remember, I talked about the little girl's eye, and I felt that it had something to do with the otic ganglia, and that when it adjusted the cervical spine, it had a reflex response, and it made a correction. So there's otic ganglia up here in your neck, not just all the way down. Otic means eye, reflexes to the eye. So this is a cervical spine. It's going to some of those cervical chain ganglia. There are cervical chain ganglia besides the rest of the sympathetic, and it is sympathetic. This is where it gets a little crazy. You know, we memorize stuff in anatomy, and and when you do memorize, if you go on to another level, you memorize that sympathetic chain ganglia or thoracodorsal. But they're cervical too. Do you understand? It's just a way to remember where you would see it when they say thoracodorsal. So there are cervical chain ganglia part of that same chain. You understand that? And then there's sympathetic ganglia, and then there's parasympathetic ganglia, which we're not seeing here. Parasympathetic are cranial sacral. That's a term to remember. Parasympathetic is cranial sacral. So all your cranial nerves are basically parasympathetic. But some sacral nerves are also parasympathetic too. And it's about control to the different organs. So different things happen under parasympathetic control than sympathetic control, right? We know that, right? Fight or flight is what? Remember, memorize this. Fight or flight is sympathetic. And then relaxation, digestion, going to the bathroom is all parasympathetic, right? And relaxing. And then when it comes to sexual activity, it's the same thing too, that an erection is parasympathetic stimulus, whereas ejaculation is sympathetic stimulus. And that makes sense because when someone's stressed out, they have problems, right? So that's an issue. So you have nerves that come from the sacral plexus that are sympathetic, and nerves that come from the sacral plexus that are parasympathetic to those organs, the lower organs in there. And going to the bathroom, think about it. When if you're having a difficult time going to the bathroom, you're stressed out. And it could be manifest in many different ways, but one is you get constipated because you're just not relaxed, right? You can't have a normal bowel movement. That's sympathetic nerves are hyperactive. Parasympathetic will cause you to go very easily, and there's a thing called paradoxical fear. Paradoxical fear is when you're overloaded so much that you lose control of bowel, bladder, and everything else. That happens to people, right? That does happen to people. And people can pass out to that point, and they pass out as well. That's a homeostatic protection, by the way. Example, if you're rock climbing, you crush your leg, and your leg is gushing blood, and you look at it, your heart rate would go up, and you'd be gushing more blood. If you pass out, it slows down the blood pressure, right? So that's all part of this protective mechanism for your body, right? All right, so what else we got here? Anything I miss here? Anybody know? Oh, the vertebral artery, vertebral veins, we said that, right? We talked about that. Okay, so let's look at the neuron.